This question asks you what's the definition of hospice care, basically. We know it's when you have a life expectancy is less than 6 months. Is that clear, folks? That's the definition of it, folks, okay? I just wanted to show you how exactly these questions are. So that's that. Now, I'm selecting questions the way I want it, folks. See here, basically, employer would like to negotiate a contract in which the medical group would provide a care to all company's employees in exchange for a set monthly fee per amount. So that means they give a set amount, they could go one time, they could do 100 times. That's capitation. Is that clear, folks? So that's that. Okay, there you see. So that's that. Okay. Now let's try this question. A 32-year-old woman comes to the office due to lower back pain after lifting heavy furniture a week ago. She recently moved to an area with her boyfriend who started a new job. Physical exam shows mild paraspinal muscle tenderness. There is no radiation of pain on either side during the straight leg rise test. Now, just to teach you a little bit about that, the straight leg rise test is to check for disc herniation. Okay, that's all it is. When that test is positive, you have a disc herniation. No neurological deficit are noted in the lower extremity. However, multiple bruises in various stages of healing are noted in her abdomen and back. When the patient is asked about the bruising, she says it's nothing. I'm just really clumsy and bump into things. Patient provides brief response and avoids eye contacts throughout the evaluation. See, that brings us suspicious that could be an abuse. Is that clear, folks? Okay. Now, which of the following is the most appropriate statement here? That's what they're asking. What's the most appropriate statement? Given the location of the bruises, I'm concerned they were caused by someone else. Is that the most appropriate you wanted to start? No. I can help if someone is hurting you, but you need to tell me about that's not how you want to start. Moving to a new city can be stressful. How are things going at home? That's a good start because they just moved to a new city, isn't it, folks? So we will leave that. No one deserves, you don't start a sentence like that, okay? Then where could you go if you felt unsafe? That's a good question. It is to ask if you have emergency plan. That's what that is. But before you get into the emergency plan, that's not how you start the statement. When you start here, it will lead to this question eventually. Is that clear, folks? Because the patient has not admitted being abused yet. So until the patient is admitted, you cannot do that. Is everybody clear, folks? So that's why C is the right answer here, folks, okay? So assessing the part here. So that's that. Okay, let's go up. A 26-year-old woman, gravid woman, para0 at 38 weeks gestation, is admitted to the hospital in active labor. 12 hours after admission, she has a spontaneous vaginal delivery of a baby boy who weighs okay. Everything looks good, that APGAR score. The patient did not receive routine prenatal care. She has no chronic medical condition and no medication allergies. After delivery, the patient is informed that her son will require erythromycin ointment to prevent eye infection and possible blindness that can cause. Remember, folks, they do that to every newborn as soon as the baby comes out, okay? Now, the patient says her son doesn't need the treatment because she has never had a STI, which makes sense. Which of the following is the most appropriate response? So in this situation, how would you respond? Although you are refusing what is recommended, I respect your decision to decline treatment. That's not the initial statement to start. First, you want to know why she even says no and what does she believe in this, isn't it? So next one. Giving medication to a healthy baby may seem unusual and unnecessary. Let's talk about why this treatment is recommended. So that's a valid way to start because, a common sense for a mom without medical knowledge, why would you put an antibiotic for something that's not there, right? So they don't understand the preventative medicine. I'm not assuming you have sexually, that's not how you started. That's a very judgmental statement. Refusing treatment puts your baby at risk of lifelong consequences from an otherwise preventable condition. See, that's a good one, but you cannot start like that. This should not be the initial appropriate to that response, right? Sometimes people can have gonorrhea without obvious symptom, which is why, no, that's wrong because you must have done a culture before the normal delivery. So they should know whether they have it or not. So here, that brings you to B as an option. Giving medication to a healthy baby may seem unusual and unnecessary, but let us explain why it's done. Okay, so that's the best in this option, folks. Okay, so that's the way. I know these questions, these are behavioral. The only way you become good at it by doing this question, eventually you will start thinking like that. Okay, that's what happens after 5-10 questions.
Oh, can I ask a question? So they would have been specific because the reason why I chose D at first was because I thought she possibly gave the baby gonorrhea. That's why I assumed we have to. But
No. See, because it says, like, even to do that, you need to have a confirmation, right? Now, before she refused, the physician has to explain the recommend why it's done. See, the doctor has not explained why it's done. After you explain, and if the patient says still no, then you could say refusing treatment puts your baby at risk. That's what it is. So not the initial response.
so it didn't matter if she had gonorrhea or not and
Oh,
passed this. You were just
no,
cool. Okay.
exactly. So here, the patient is obese, BMI 50. Now, fasting glucose is 128, not bad. When the subject of her weight is mentioned, the patient says, in my family, we just like to eat. My mother is heavy, father is heavy, and my kids are heavy. There's no point in trying to lose weight. But then she has blood pressure, okay? She has increased blood pressure. Which of the following is the most appropriate response to the patient's statement? What do you respond to this line? Do you want to tell them bariatric surgery might be a good option if you consider? Don't you think it's too early in that conversation? Okay. Even with your family history, simple changes in your diet can lower your blood pressure. That's a good one. But you need to know what's the understanding of the patient. Like you need to make sure patient knows blood pressure is connected to weight. Is that clear, folks? Without explaining that, this is not a good option. Tell me how you think your weight might relate to your blood pressure and glucose. That's a good one. That allows you to understand their knowledge of weight related to blood pressure. Okay. You can still eat whatever you want as long as you don't eat much now. You don't have to lose all the weight at once. No. So here you have these two. So in my opinion, B will be the right, but not right away. So you start the conversation here. Once the patient tells you, you know what's their understanding. If they don't even think that weight is related to blood pressure, no point of giving that hint. Does that make sense, folks? So you need to know what's the patient's understanding. That's what it is here. Okay. See, that's the second highest, because if they say, then you could tell that, even losing a little bit, it helps over a period of time. Everybody clear, folks? 59-year-old man comes to the office for a follow-up. The patient had an acute MI a month ago, and stent was placed. He has no cardiovascular symptom, but he does have hypertension and hyperlipidemia with 40-pack-year smoking history. Blood pressure, okay, BMI. Physical exam is unremarkable. The patient says, I can't wait to get back to work, but at the same time, I'm concerned about having another heart attack. I have a high-pressure job, but I need to find the time to exercise. Plus, I know I should stop smoking and lose weight. So he has many things in his mind that he wants to do it. Which of the following is the most appropriate response by the physician at this time? At this time, having a heart attack was frightening. It's great that you have decided to stop smoking, lose weight. He knows it already. Why do you have to tell them again? He already acknowledged that he wants to change those. I suggest we prioritize quitting smoking first. First, you need to ask patient what's the situation or where you want to start. Now, how do you come up with smoking is the first thing? No, so we cannot prioritize that. These are excellent goals. Let's make a comprehensive list of health changes you want to make. Not only health, he also has a high pressure job. So you can't just change the health without changing that. You see how they play with one line? That's what that goes wrong. You have been through a tough time. Would you consider working few hours for the time being? No. You have brought up important issues, which is true, that he brought up all the list what he need to do. We need to ask, what are 1 or 2 small changes you feel most ready to tackle now? Because you can't just be successful in everything, right? That's where you start here, folks. Now, I like the C, but not just the health change. They need to change everything overall, folks, okay? That's the idea. So that's the key here, folks. A 40-year-old unemployed man with a chronic back pain comes to the office for an appropriate appointment with a new physician. The patient injured his back in a work accident years ago and has not worked since. He uses marijuana daily to ease the pain and admits that the portion of his income goes towards its purchase. The patient says that nothing has changed and asks the physician to sign a disability form so he can continue to collect disability benefit. By now, what did you believe at this point? It seems like patient knows what he wants. Okay. Now, when the physician asks about his disability and previous treatment, he replies angrily, I wouldn't be here reapplying for disability if anything had worked, and slammed the disability form down on the table. So that tells you he doesn't like questioning, so which means it's not the right way, right? Review of his medical records indicates a normal MRI 1 year earlier and an inconsistent adherence with physical rehab appointment. Remember, we studied in psychiatry. When you have a primary, this is the primary gain or secondary gain? It is a secondary gain. He is doing to get the disability. Primary gain is to act like sick. So this is a secondary gain, okay? And he never keep up with this. The patient walks normally with no apparent discomfort or anything. So you know doesn't seem like. So without looking at the option, don't look at the option. When you look at option, this will confuse. What do you want to do next? You're going to sign the paper? No, we cannot sign, okay? So what do we need to do? We need to do more research on the situation to see if he truly has problem or not. Is that clear, folks? Okay, so by looking at it, I'm unable to sign the form due to my concern about your drug use. No, that's confronting the patient. You cannot do that, okay? I'm unable to sign the form due to my concern about inappropriate use of disability benefit. Even though it is true, you can't really tell that to patient, right? That's kind of rude, okay? I can see you are suffering from, no, he's not suffering. I can sign the form because I see that you were previously approved. No, that's not how it works. I cannot consider your request until you are able to control your anger. That doesn't work. I cannot sign the form without further history and assessment. That will be the appropriate response, folks. Okay. Now that's the idea. You see that? So most of the time when you read a question without looking at the option, think in your mind what you would want, then look for it, because sometimes they put options are so close to each other, easy to miss this question, folks. Okay. When you call your primary care physician to make an appointment, do the nurse ask you, why do you need that appointment for? You have to give a reason, right? What do you tell? Why you are coming there for, right? Okay. So here, the patient comes for his type 2 diabetes, hypertension, and hyperlipidemia, and they are inadequately controlled, requiring multiple modification to his medical and regimens. Okay. Extended counseling is provided regarding today's change. That tells you physicians spend enough time to explain all the changes made. And while he was leaving the room, he's bringing up a new problem. Can we talk about this today? Now, keep in mind, folks, in an outpatient clinic, they schedule so many patients every day. Okay, like usually it's about 40 to 60 patients a day, and they are given a time slot. So when they come to that particular problem, that's what the problem they were supposed to deal at that time because of the time consuming. Okay, so here the good response here will be, it sounds like we should talk about this because you don't want to ignore it. He has a urinary stream problem and he has another appointment within a month. Or, however, we are out of time today. Please make another appointment so I can appropriately evaluate you, which makes sense because you can't rush into things. You have to do it properly. Okay, that's the most important thing here to do, folks. Okay, so anything else comes closer to this here? I can evaluate the urinary issue today, but it won't be as thorough because we have limited time. You don't do like that. If you do it properly. If not, you don't. Okay. Any other option? So that will be the best option to do it, folks. Okay. Now, remember, whenever you make outpatient clinic appointment, if you say you are coming for annual physical, they always give you more time for that slot. Because in annual physical, they go through the whole body symptom. That's where you could talk about anything you want. But if you are coming for a follow-up, you only talk about that particular things, folks, because they schedule it like that. Okay. Now, that's the idea. Okay. Now, some physicians are nice. They still take the time to evaluate, but that pisses the next patient off. Right. And then it follows all the patients later after that, folks. Okay. So that's that. Nineteen-year-old woman comes to the clinic due to nausea and abdominal pain. She struggles to describe the pain and frequently points towards lower abdomen. The patient shakes her head no when asked, and if she could be pregnant or sexually active. So you kind of get an idea. She has a language barrier. Okay. Now, when she asks about her last menstrual period, she nods affirmatively, says no. She's single and immigrated to the United States from a country in South America several months ago. So that kind of gives you enough information. There's a language help. Physical exam shows moderate abdominal tenderness with no rebound or guarding. The patient is discharged home with a diagnosis of food poisoning. Later that day, she is taken by ambulance to the emergency department after experiencing severe abdominal pain followed by a loss of consciousness. A diagnosis of ruptured ectopic pregnancy is made. Which of the following intervention would most likely could have prevented? Where do you think things went wrong? They should have had a language interpreter to use that. Otherwise, it's a pure error here, right? So here, asking the patient whether she feels comfortable, no, that's not the reason. Here is a language. So the answer is about the language assistant, folks. That's the most important thing we do it in the clinic. We have that phone line, right? You call, you could get any language, and then they will come in there and explain, folks. All right. So that's that. Okay. Now, I like it. Everybody is going for C, okay, this question. But can you guys tell me why not B? You could talk. Somebody. Why not B? But I will tell you the right answer is C. Okay. But I want you guys to tell me why not B. B is a very good one. So basically, the patient says if the biopsy shows cancer, he doesn't want to know. Right? Now, the B option, I can't imagine how stressful this is for you, but if the results do show cancer, it would be important for you to make a decision because every day they wait, it can spread, isn't it, folks? So tell me why B is wrong, even though right answer is C.
I think B is kind of like leading the patient in one direction. It's slightly pressuring to the patient in one way or another.
Okay, what is the best one? A little bit more.
I think, like you said, we always ask why, whatever they
There you
decide.
go. So even though this is talking about the treatment and pressuring, as Iman and Wayne said, first, don't you want to find out why he doesn't want to know? So first you get this, and then after he explained, you could go for B and say, you know what, we need to kind of know to make a decision about the treatment. But before you tell that to a patient, you want to know why do you think so? Does that make sense, folks? Always know that before you direct the patient, folks. All right, good. "82-year-old man with a history of advanced Alzheimer's disease is brought to the patient by his daughter, who's a power of attorney and caregiver. She says that her father is increasingly confused and verbally aggressive. He's admitted to the hospital and found to have a urinary tract infection. IV antibiotics are initiated and he appears less disoriented and agitated, but remains unable to recall nursing instruction throughout the day and fairly non-verbal. 3 days into his treatment, the antibiotic order expires and is missed by a physician, nurse, and pharmacy staff. The patient receives no medication for 2 days before the error was found. So there was a mistake happen on the hospital side. That's fine. There are no consequences to this error other than the extended of the hospital day. That's also fine. What do? Of course, you need to accept the mistake that happened and apologize, right? I know most of you guys went for C and D. Why D is the wrong answer? He's Alzheimer's. That means he is not comprehensive, so you cannot talk to him. You have to go to the doctor. Okay, he's not in a state of mind to make decisions and judgments, folks. Okay, when they're Alzheimer's. When somebody's Alzheimer, they cannot make any decisions. That's why they have a power of attorney. So everybody clear, folks? So here, the answer is inform the daughter and disclose an error with apology. So that's a mistake we have to accept. Does everybody agree with that? Do you have any other option here that you think is better? Okay. Now, next step. You could give me two options that you think. Good. So in here, this is related to the previous question. There's few more cases happen after over the next several months. They ask me which of the following is the most appropriate next step in addressing the problem. You need to find out where the mistake is happening. Most of the students pick A and D. Both are right answers, but which one is the first one? First, you need to interview pharmacy, nursing, and medical staff on the units where this mistake happened. Don't you want to find out why it happened before you give a solution? A is the solution. But before you make a solution, you need to know why it happened, right? So if I say that after this, then A is the right answer. But find out where the problem is. Okay. You need to know why. That's what it is. Look at that 57% and 33. So that's why it says only when investigators determine why this occurred, then you could recommend specific things to prevent that. Because you need to know where the problem is. Does that make sense, folks? Right. This is a very common scenario that happens in the ER. They come to the hospital and they don't want to wait and they don't like they want to leave. Because once you admit them or register them in the hospital, that means they are documented patients. Is that clear, folks? Once they are documented, they are more than welcome to leave. But before they leave, what needs to be done? They have to sign a normal letter. Okay, basically. So here, which of all is the most appropriate if you want to go home? What do you ask a physician? You tell what's the risk when you leave recovery treatment. Is that clear, folks? And then they say that you understand everything and say yes, then we give a reference sign because everything goes wrong after you don't become responsible for it. Okay. You can't hold the patient to your rights here. So explain the potential risk of leaving the hospital without evaluation. And once they sign, that's what it is. It's all going engaged with medical advice. Is that clear, folks? But they have to sign a paper, not without signing. Okay. So that's the idea.
Dr. I have a question about this one. If so, I noticed the blood alcohol level is 0.07, so it's still below legal limit, which is 0.08. If it said it was higher, like 0.1, 2 or something like that, could you is the ever the right answer? Because there's like there's
Yes. So what happens is the question is also here he's with his wife. So you will only be if he becomes alone husband. As long as there is someone driving home, you'll be okay. Okay. So let's say I agree with you and the patient comes to the ER and he's not around alcohol is high. You keep him until he's over.
Okay. Thank you.
Right. here, folks, the family, so patient is a 71-year-old woman with metastatic non-small cell lung cancer is admitted to the intensive care unit, and it has a malignant airway obstruction with post-obstructive pneumonia and sepsis. So oncologist calls the admitting physician to provide sign out saying the disease has been progressing. Our plan was to start a third-line chemotherapy regimen next week. Despite receiving antibiotics and supportive care, she has a rapid deterioration of her respiratory status with a very high likelihood of dying in the ICU. When the physician discusses the patient's condition, the patient and family says whatever might have a chance of working, we want everything to be done. So they just want every possible way to do things, right? So which of the following is the most appropriate response? What are you going to tell the patient? Given a major change in your clinical status, I want to revisit what do you mean by everything. Don't you want to know what is they mean by everything to be done? It's a very tricky word. Okay, so now let's say you don't take that. Have you had a discussion with your colleagues? They're already talking about it. They already say the discussion is done, so that option is gone here. I am afraid that continued aggressive treatment could cause more harm. I agree, but you still want to understand what do they mean by this line. Because you cannot assume anything in this. Whatever they mean inside, you have to know what exactly you mean by that, right? So that's why. Now this is not right, so this way you go with A for the right answer. You need to know what do they really mean by that, folks. Okay. All right. We did that. Where is this one? Yeah. In this patient, you should ask who makes the decision, patient or son. So that brings you to your question. The patient has Alzheimer's. Usually Alzheimer's cannot make a decision. But where is